Hello there. I'd like to welcome everyone here today. I'm Councillor Matthew Winnington. I'm the Cameraman for Health and Wellbeing and Social Care, and this is my decision-making meeting this morning. Just some domestics first, in case there's any fire alarm. We're not expecting any, so please do evacuate. And the place to meet is at Queen Victoria's statue in the Guildhall Square. So if I can start off, we'll just go around the room just to get some introductions. So if we start with you, Andy.
Thank you, Andy Biddle, Assistant Director, Adult Social Care, Portsmouth City Council.
Claire Curry, Consultant in Public Health, Portsmouth City Council.
Jane Didino, Local Democracy Officer.
Councillor Graham Healy, Labour Councillor St Jude and Opposition Spokesman on Health and Social Care.
Luke Stubbs, Conservative Group Spokesman.
Richard Webb, Finance Manager.
We have a couple of people in the public gallery, including the press. I'd just like to say who you are. Thank you very much. Okay, so if you start off, apologies for absence. We don't have any apologies for absence. Do we have any declarations of members' interests? No. Okay, so if I can ask Claire to introduce item number 3, public health aspects of the Portsmouth Health and Care operating model.
Thank you very much, Chair. Just to note as well, apologies from Jason Hawes, Director of Public Health, on this paper today. So as you know, the direction of a single operating model for Health and Care Portsmouth has been agreed by the Health and Wellbeing Board and the CCG governing body last autumn. This paper provides further detail on the public health aspects of this integration, specifically gives an overview of the progress, as well as opportunities and next steps. So there are 3 areas where progress has been made. Firstly, on the overall governance arrangements, being through the Health and Wellbeing Board and through establishing the Health and Care Portsmouth Commissioning Committee. Secondly, in progressing the Healthy Child Programme commissioning arrangements, which includes some mandated public health functions. This will form part of a wider 0 to 19 service being led by the Director of Children's and Families and will feed into the Health and Care Portsmouth Commissioning Committee. Thirdly, strengthening information intelligence functions will be a crucial enabler for informed decision-making within the future operating model for Health and Care Portsmouth. There needs to be capacity and capability to turn data into intelligence and to present this in an engaging and accessible way to inform decision-making. Progress has been made through recruiting a strategic role which will aim to work with colleagues across the local system to develop greater coordination of intelligence under the remit of Health and Care Portsmouth. There are a range of further opportunities within the public health related functions. Currently there are several interdependencies between services commissioned by Public Health and those commissioned by Portsmouth Clinical Commissioning Group. Unifying these arrangements will have benefits for local residents as well as for planning and delivery. Specific areas are sexual health services and pathways, supporting individuals who have a dual diagnosis or substance misuse and mental illness by bringing these areas closer together, and in work to prevent long-term conditions. Beyond services directly commissioned or provided, Public Health is able to contribute to decisions about wider service planning and delivery. Contributing to shaping emerging primary care networks is an example of this. But Public Health can also play a role in exploring where the CCG can further contribute to Portsmouth City Council priorities, for instance in perhaps tackling air quality or in supporting individuals who are homeless. Immediate next steps to focus on include continuing to develop the operating model to deliver the public health responsibilities of this work, and also in continuing to strengthen intelligence functions. I'm happy to answer any questions on the paper.
Thank you very much, Claire. Any questions or comments, Luke and Graham?
Well, no questions, but just on as a comment, since you invite that, then And I think that there's a lot that's positive about this. The move of public health from the NHS, some of the boundaries were never very clear. I never really understood why sexual health services came over to local authority when really they're health services. They are here and just about everywhere. They're provided by healthcare providers. So it's always felt like that's something which the NHS just had to roll over. So I think that this is reasonable, and I made some other detailed points in the briefing meeting that I'm not going to restate.
Yes, I mean, I obviously saw the timescales on some of these things because you're talking generally about wanting to do this, but obviously I don't know quite when that will happen. And interesting, you're making some points here about the research and what it will do in terms of trying to get better understanding about evidence and interventions. I mean, that's obviously quite important given the amount of money spent on health provision and also health prevention, what actually works.
It's important to set out how the public health side of the work we do in the council is integrating with the CCG. That move there to have joint support with the CCG for the Director of Public Health, and obviously Children's Services, Head of Children's Services as well, is really important. And as you said in your presentation, the importance of that cross-working on big issues that really transcends, that aren't just stuff to do with the council, they're to do with things, including, of course, air quality, which, of course, is such a big issue at the moment. And as Councillor Stubbs pointed out, some of the splits that were put in with when public health came into councils and what stayed in the NHS were, I think they've been described in many cases as perverse, and this goes some way to creating an integration between those, which is then effectively recreated that existed previously when they were with the NHS. So I'm very happy with that report. I'm happy to accept it, and as the recommendation is there, that I note this report. So thank you very much. Okay, so we're on to item 4, and this is the adoption of residential care and ethical care charters by Portsmouth City Council, and I believe this is you, Andy, leading.
Thank you. So this first report deals with 2 charters that have been drafted by Unison Trade Union Organisation. The Ethical Care Charter has been around the longest, and the Residential Care Charter is a more recent addition. These charters have been discussed in council before at various levels with various councillors. This report sets out the current practice in relation to the charters of Portsmouth City Council Adult Social Care. We've put some information in there in terms of context around the direction for adult social care over the next 2 to 3 years, the strategic approach we're taking, and attempting to come back into financial balance whilst providing the services that we believe are needed in the city. This follows on then into the Ethical Care Charter, the first charter on page 1, as it's labelled, but page 11 of the actual full briefing pack. And what we've tried to do is lay out the criteria as in what's listed in the charter, and the current practice within adult social care within the council, and any gap or impact that we see from that practice. I think it's a reasonable summary both for the Ethical Care Charter and for the Residential Care Charter, that in the main the council's terms and conditions and operating practices mean that adult social care practice is pretty much aligned with both charters, and that what we need to do, what we're recommending we do, is engage with our colleagues in non-public provision in the city and understand whether we can support them in adopting some of the parts of the charters as they're laid out. So that's our recommendation. So the charters deal with commissioning of visits, the time and task nature of domiciliary care, particularly home care workers and their terms and conditions, travel time, travel costs, necessary expenses, scheduled visits to ensure that people's care needs are met, Statutory sick pay, the allocation of the same worker wherever possible. It deals with and discusses 0 hours contracts, and also talks about, broadly speaking, safeguarding and wellbeing. Training for workers and supervision for workers is also covered. The living wage is discussed, occupational sick pay also, and in the residential care charter, staffing ratios to ensure that there's consideration of wellbeing for people living in residential care, not just of basic care tasks. Information around concerns, again dealing with safeguarding and wellbeing. Accountable procedures to follow up concerns, access to NHS services within the city, risk assessment, equipment, and training. Again, there's some mirroring between the charters because they're dealing with the business of providing care and support. Wages, terms and conditions, and then discusses sleep-in and holiday periods. So the recommendation is that that the Cabinet Member agrees to adopt the principles of both charters within adult social care in Portsmouth City Council, and requests officers in ASC and in other relevant departments in the Council to engage with care providers in Portsmouth to share the charters and explore how providers can align with those principles across the care market. Happy to take any questions.
Thank you, Andy. I'll start with just questions to start with so far this time. Any questions? Luke? Yep.
In the light of the recent court judgments there have been, what is the Council's current and planned future position in respect of sleeping nights?
The current position is that we are paying a sleep-in night because the last judgment did not uphold the hourly rate paid. So we continue with our previous arrangements with providers, but we take account of the amount that we're paying them for a sleep-in night, depending on the provider's costs.
I might have missed some of this. I thought the most recent judgment overturned the minimum wage ruling in respect to sleeping nights. Am I wrong on that one?
No, you're correct. So it's not an hourly rate of pay; it's a pay for a shift, and that's still our practice. My apologies.
Any questions, Graham?
Well, I suppose a broad question. How are we going to monitor this?
But,
So how are we going to... Anyways, I'm not used to this. See, we lecturers just talk. We don't bother to put microphones on. So how are we going about monitoring this?
So what we've laid out there in the charter is how we know what's happening in Portsmouth Adult Social Care. So, for instance, if I scroll back to the top of the residential care charter, in terms of adequate staffing ratios, we know that's the practice. We're involved at the moment with designing the model that we need in the care homes that we run, and we've put in some extra staffing to deal with some issues that we've had over the past couple of years. So it's a fairly continual review, really, and it links to the adult social care strategy, particularly in residential care, of designing the model we need of staffing. So it depends very much on the area that we're looking at, but a lot of these issues are in continual discussion and continual monitoring for us, certainly.
okay, anything else, Graham?
I'm going to have some general comments, and I
Yeah.
want to put a proposal forward as well, if I may, at some point.
Thank you. I'll just stick with questions, then we'll go to comments in a moment. Thank you, Andy. In terms of the, you said about the engagement with the care providers. Can you just tell us a bit more about how we're going to go about that?
So what we've been doing probably in the last 6 months or so is having more regular discussions with our providers, both for domiciliary care and for residential care within the city, meeting face to face, talking about the pressures and the issues that they have within their industry. And so what we propose to do is to take this paper to the next of those discussion groups that we have and talk it through with them and make a start from there, and then start mapping out the individual bits and pieces within the charter, what they see as achievable, what they see as challenging, and work methodically through it.
Thank you, Andy. Now move on to comments. Chair.
Okay, well, this has got quite a long history, and back in 2015, I led the rejection of this when this came up as a motion to full council. And, you know, I kind of feel vindicated because while this report is written in such a way as to say the Charter is being met on the three big things within it, it's not, which is the paying the not the National Living Wage, the Living Wage Foundation's living wage, not having quarter of an hour visits, and paying the minimum, or the living wage, during sleeping nights. Now those are the three big, expensive, big ticket items in there, and it's not proposed to meet them. And I agree that that's the right thing to do. I think that sleeping nights, firstly, is very difficult to justify anyway. And then the other two items, well, frankly, it's not, as I said in 2015, it's not affordable, and to attempt to meet it would be to put an unreasonable burden on taxpayers. So I didn't think it was deliverable in 2015. I don't think it's deliverable now, and I think that this report implicitly recognises that because the big ticket items are not included.
Thank you, Luke. Graham?
Thank you, Chair. Yes, I mean, I did notice that there wasn't any evaluation of what the Foundation Living Wage would mean in terms of cost. In fact, I took the opportunity to have a look at a couple of other reports from other local authorities. I went and looked at York to see what they'd done in terms of their implementation. I also picked up a report from the Association of Public Service Excellence where they looked at Reading's implementation of this, just to get a bit of a feel for what had gone on in other local authorities. I think the York report gave some quite interesting information, which is not included in our report, suggesting two things. One, it actually put a cost in for the local authority of having the Foundation Living Wage as a baseline, if you like, but also suggested that it wouldn't be potentially legally possible for the local authority to require that of their providers. I don't know if that's the case. That's obviously their advice, but we haven't had any advice on that. But I want to come back to this in a moment, which will be my suggested proposal. I mean, when I asked the question about monitoring, I mean, I did go through a couple of things in the report. So, for example, on page 2 or page 12, depending on how you look at it, I prefer the paper version myself, where it says healthcare workers to be paid travel time, travel costs, and other necessary expenses. And basically, what that seems to say, if I understand it correctly, is that we, the local authority, include a cost for this. And that's what we say. It doesn't say that the providers actually pay it. So the question was monitoring. How do we monitor this? I did ask some questions at the last meeting about this, and the reply I got was that, well, we have monitored pay slips in the past, but it was something like 5 years ago. We haven't really done anything much since then. Interestingly, one of the local authorities, I can't remember if it was Reading or York, I'll have to remind myself, but they actually monitor job adverts to see what the employers are actually offering. Obviously you can find them, but you could clearly ask the companies to provide job adverts to make sure they are actually advertising, that they do actually pay that. And also, you could ask for information from them about that. A couple of others I wanted to just mention as well. There's page 14, home care workers to be regularly trained to the necessary standard, provide good service, etc. Again, it says it's a requirement of our contracts, and it's expected to be provided and paid for within work time, etc. Some is available to the PPC, but again, it doesn't say that we actually know they do it. It just says this is what we expect. So how do we monitor that? I think it would be reasonable to ask the providers to tell us a bit about how they do their training again. It's York, I think, has actually done that, and they've actually picked up whether they're doing training or not. The living wage, obviously, that's a statutory requirement, so no issue there. The occupational sick pay scheme is also another area where there's a cost implication involved, and I think it's York talked about the potential impacts of that, and I recognise that some of them won't necessarily have one of those, which presumably means that the only thing workers would be eligible for would be the statutory sick pay, so there isn't effectively that for them. But it's probably good practice, I would have thought, for them to try and develop these things. Obviously, we couldn't require it, but I think it's good practice. I've already mentioned the bit about the Foundation Living Wage, because we're now on to the second part of it, which is the presidential care charter. And there is one on page 19 or page 9, depending on when you look at it. One of the boxes is duplicated. It says exactly the council outsource employees on or above the living wage, and it's exactly the same. So maybe that needs a minor amendment. The sleeping one, it's obviously a difficult issue, and I suppose it comes down, what is the best thing for us to do? Clearly there's been a legal judgment around that, and I think we should seek to pay our care workers, or care workers we seek to pay the best rate possible, really, I suppose. So I would think it would be good to pay people that, but I know the current legal judgment is that we don't. The other last one on page 10 or page 20, holiday periods must be paid if at work. Again, it says statutory requirements, but again, we don't absolutely know that they do that. So on the basis of that, what I was going to suggest is that I understand there's more work to do, and not wanting to put undue pressure on people, it would be good to maybe set out a bit of a timescale for how we review this. And I probably think that it would be worthwhile, and I hope the executive member, I think this is useful, if we maybe had a report annually on sort of how this is being performed. But we also need a bit of a baseline to start with, and I think we're still not quite there because we don't know what we're monitoring, we're not quite clear what we're sort of checking, you know, when we're, and I was wondering if it would be, I think it would be a good idea maybe to look at over the next 6 months, if we're going to engage with the providers, to maybe have an initial baseline assessment for, say, January, where we've got some of the information together. We may not have it all together, but we could do some of the, we're monitoring and things like that. I've suggested job adverts, pay slips, etc. We've got some agreement about what we're going to be monitoring to monitor this. And we maybe do an initial report, say in January, that gives us 6 months. And that's our sort of baseline to work from. And then we maybe have a report each year, maybe every January, just to see how it's going, how it's progressing. Because obviously, say, some of this has wider cost implications, and the council hasn't agreed to do things like the foundation living wage. We might want to explore that at some time in the future. So I think that would get us off to a reasonably good start, because the danger, I think, slightly with this is that it gets approved today, officers go away and do, you know, genuine work, but we don't really find out much about what happens afterwards. And you know, next June is a year away, and will I be here in the same position next year? I don't know, but it'd be nice to have, if we had a clear recommendation that we start the review process, if that would be possible.
Thank you, Graham. Andy, did you want to respond to any of that?
I'll leave it to yourself to decide whether we indulge in that review process. I think you're right. There are limited legal powers that the council has to enforce this when it's working with its providers. The contractual terms and arrangements are reviewed, possibly not in the detail that you're talking about. We do have some contract officer function that work with the providers, and when we set the rates each year, there's those discussions around what those rates are there for. But I think the more detailed and analytical review that you talk about probably doesn't happen. I think that's fair.
Thank you, Andy. So as the start of the reports said, this is coming off the back of going back to July 2015, when it was first proposed to council by the Liberal Democrat group that the ethical care charter, which was the only one that existed at the time, out of the two, would be adopted by the council. Unfortunately, that was, as Councillor Stubbs has stated, was rejected by the then Conservative administration and their and other parties on the council. And as somebody came back and said, that was an unethical decision in a. When that report came back from that particular cabinet, I'm very pleased to be able to present this care charter, the ethical care charter, and of course the residential care charter, which has been created since then by Unison. I'm one of the things that I think with things like these kind of charters is that this is a statement of intent. And I think that's very much a point that I think, though Councillor Stubbs may have some specific issues that may or may not be the case, I think the point about the Charter as a whole is far more important than any particular part of it. It is more than the sum of its parts. Both of them are. And I think it's really important for us to set down a baseline. In a way, actually, Graham, I would say that that it's a baseline of a sort, is the charters themselves, so I can absolutely see where they are. I have given a commitment to Unison that obviously we will, and I will be adopting these, that we will be doing a signing and we will be doing some conversations with them to see how to move along together with them and obviously other unions in terms of how we implement this and how that monitoring is. So I'm not going to put down a specific recommendation for a monitoring specifically, but I will give a commitment that I would certainly see this as certainly to start with, we would have a report back this time next year, but in the meantime, we would be having monitoring and we would be working with the unions and the care providers to get that kind of baseline, because I think one of the things is before we get together with those care providers, we don't really know what that's, what it looks like with all of our care providers. So I think I'll stick with the recommendation as it sits, but I will give a commitment that we will talk to unions about this, obviously specifically Unison, and we have to sign things. And the second thing would be to look at that we would have that I would take a report back later this year, later this council year, and then we would do a monitoring probably next June as well. But I can't stress really how having a baseline for what we do in our care systems, both our in care and both domestic and residential care, how important that is for this city. Because if we don't get this right, if we're letting down our people in our residential and domestic care environments, then we're not doing the best by the people in the city. And that's always been mine and the Lib Dem administration's reason for backing these charters, to do the very best we can to meet them and to support the rest of the care industry in the city to be able to do that as well. I also do think it fits in, as 1.2 of the report says, it fits in with our blueprint for health and care in Portsmouth, and this again is something that is really important to me and the rest of the Lib Dem administration. So I'm going to, with one small amendment which Graham did point out, we have a duplicate, so if we can just remove on page 9 of this report the duplicate box, but then we will stick with the original recommendation, which is that, if I just get it on my bit of paper. So I will stick with my the recommendation as published, that the Cabinet Member for Health, Wellbeing and Social Care agreed to adopt the principles of the ethical care and residential care charters within the Portsmouth City Council Adult Social Care, and request officers engaged with care providers in Portsmouth to share the charters and explore how providers can align with those principles across the Portsmouth care market. And also, not a recommendation but a commitment that we will work with providers and unions on how this is implemented across the board, and also that there will be a report back later this municipal year, and that we would look to monitor this again next July.
Chair, can I just clarify, what is this report that's coming back sometime that they're going to do? Because it sounds like it's a baseline review, which is what I was suggesting in January. So what is it going to do? Because I lack of clarity. I want to be clear what the decision is being made and what is actually going to happen.
Yeah.
So what is this report going to do?
So it would be about it would be pretty much what you've asked for.
Oh right.
Yeah, absolutely.
Because it wasn't clear.
Absolutely, but
you're saying you weren't going to accept my recommendation, then you're saying you are.
No. It's just not putting it in as a recommendation, just putting it in as a commitment, which is a different thing. Just to make it clear that it is a it is a report that will come back and which will effectively monitor things, but it will be in a way of a commitment rather than recommendation, because I think the recommendation just staying as it is, because what exactly that report looks like, I don't think we can second guess at this stage, because that was going to be driven by those conversations we have with the care providers and with the unions as well about what our baseline is going to be in that way.
If we discover, or one of my colleagues is concerned that some care providers do not provide the travel time, how would they be able to bring that up now? Because they have indicated they have some evidence, and they asked me they pointed this out to me, so what would they do in the interim until we've agreed? Because we're not going to review this until next year. If we're not formally going to review it for another year, what would they do? How would they bring this up?
Well, that, as Andy said, we will be having conversations with the care providers. So if that information is passed on to myself and Anis and Andy and Angela, then that would be able to be shared with the care providers. So that would be part of that conversation that we could then have. Yeah, and as I say, I'd like to just finally on this one, I'd like to thank the management team and team across adult social care in the way they've been interacting with care providers in the city. It has been really positive in the last year or so, helped I think by the adult social care conference which Judith from Labour and Luke from the Conservatives attended, and I think that's been a really positive point of view for us to be able to move along with these kind of things in a really positive way. Okay, so that's that one done. And I think it's back to you again, Andy, for the Section 75 agreements and mental health services, item 5.
Thank you. So the paper, the next paper, item 5, is asking for the approval of the Cabinet member to agree the extension of the current adult mental health agreement for a period of 3 years until the 1st July 2022. For some time now, services for adults with mental health problems have been provided in partnership with Solent NHS Trust in the city. This is a service for anyone over 18, and we also have a transition protocol that we're contributing to in common with our colleagues in children's services to ensure that people who have mental health problems identified prior to 18 have a pathway that they can transition through into adult services. The AMH service in the city is well established. We'll link to the Wellbeing Hub once the hub is fully established itself. And PCC have staff based directly in Solent NHS Trust teams working with adults with mental health problems. The numbers are in the report, and there's elements under section 4 of the governance stroke audit arrangements for the service. Moving from individual meetings through to a strategic level view of what's going on in the service, performance standards. We've also been fortunate to have a recent thematic review, which I've highlighted under 4.2, where we were commended for the multidisciplinary teamwork that we do, so that it's less likely that there's a barrier between health and social care, which there can often be because of the joint working that we have in this service. Two of the primary objectives under 4.4 in mental health services for adult social care are to decrease the number of people in residential care, support more people to return to live in the community, and also manage with the resources allocated to the service. In terms of the resources, what we've managed to do working with colleagues in Solent is reduce an overspend that was quite substantial in 2014 down to, whilst still an overspend, a much lower one that we'd hope to bring back into budget. And we've also decreased the people in residential care in the last year by 10%. We're also looking, as members will be aware, of increasing our supported living facilities in the community in Portsmouth to make an even greater impact, and so that people are living in a more appropriate environment. The integrated service itself is successful and well received by the people that it works with, and as I say, the main benefits to the people of Portsmouth is it removes the barriers between health and social care. It's working within one team communication is faster. We have now implemented the System 1 client record system in the whole of social care, so that social care and the NHS in Portsmouth is operating on a single system. We've had that for some time in mental health, but we're now seeing the benefits in the wider service as well. So the recommendation is to ask for that to be agreed until 2022.
Thank you, Andy. Any questions or comments?
Not really. I mean, I was a little surprised actually looking at the report. I thought this had been in place for a lot longer than 2013. I thought it was more like 10 years, but there you go. Yeah, it's just rolling over the current arrangements. I think it's very sensible, and I would support it.
I think I agree. It's sensible to have 3-year contracts rather than annual contracts. Much more easy to manage and a good proposal. So I'm happy to support it.
Thank you both. Yes, I think this is very sensible. This has been a service that has, I think, gone from strength to strength. We've managed to get it also a very good service for and as you said, reining in the overspends, which is really positive as well. And from my professional life, I've had interaction with the service, and I found how having that the co-production, the staff being together on site, both from Solent and Portsmouth City Council, is really positive, and it really does make a difference to people to be able to have that triage all together rather than a fragmented service. So I'm very happy to support the recommendation as on the paper. So that is to the Cabinet Member for Health, Wellbeing and Social Care agreed to the extension of the current Adult Mental Health Section 75 agreement for a period of 3 years till the 1st of July 2022. And that concludes the meeting. Thank you very much, everyone.